Everyone, more right now on the coronavirus here in Connecticut. Growing concerns about cases climbing after the state's positivity rate now stands at 4.1%. Joining us this afternoon to talk more about this is Keith Grant, an APRN and Senior System Director of Infection Prevention with Hartford Healthcare. Keith, thank you very much for joining us.
Absolutely. How are you doing?
I'm good, thank you. I'm imagining that you are not all that surprised to see cases climb. How do you think this is going to go? Do you see a timeline here before things level out?
So that's a very difficult question. I think, when we look at what's called the R factor, I think a few days ago, there was this data that came out. Our current R factor right now in Connecticut is 1.12. And when you see the R factor goes above 1, it shows that the pandemic has the ability to spread. And at this point, I think if you look at the data a few days ago in New London County, there's areas that are about 6.8%. So we're seeing significant increase in many areas. A few weeks ago, if you look at Connecticut's data, less than 6 weeks ago, most areas in Connecticut was below 1. So it's concerning. Do I expect it to move anytime soon? Based on this data, I would say not until the next about 2 to 3 months before I start seeing some level of stability.
Oh, goodness. All right. So you're looking at a few months of this. I mean, obviously, you're concerned right now. I want to ask you, do you go out to eat? Do you go places yourself or with your family?
Yeah, I think one of the most challenging things for us as healthcare providers, especially infectious disease and infection prevention, is how do you spread the message at the same time not incur fear, right? Yes, definitely. I go out to eat with my family, but the most important thing is identifying any potential for spread or contracting the disease. And if it does happen, get tested, realize your symptoms really quickly, and address them as soon as possible and isolate yourself. But absolutely, enjoy your families.
Well, that's good to hear. I think people like to hear that. You're very calm. That's helping us all. You mentioned the symptoms right there. Are they the same right now as they were a few months ago when this all started back in the spring?
That's another good question. So the symptoms remain the same, right? The thing that we have to be very careful with right now, so we're in a season that a year ago, what we would be looking at is if I come in with the sniffles, you said, you know what, I have allergies. So that's a big difference now. So we have to be more astute to things like this. So the symptoms generally remain the same. The thing that's changing a lot is there's a flip. So the under 30 age is seeing a significant increase. The over 60 age is seeing a significant decrease. It's a good thing when you look at mortality rate in, or older population. But it's a bad thing in that the under 30 group is still the more social group, the group that goes out and mingle with more people and have the potential to be more effective vectors.
Well, Keith Grant, I certainly appreciate you joining us right now. You've helped calm all of us here in the studio and hopefully people at home as well. So we appreciate that. And we thank you and all of your colleagues for doing what you're doing because the work is tremendous and admirable for sure.
Absolutely. Have a good day.
Thank you. You too.